This old supplement has become really popular in the last few years due to its benefit on metabolism, from lowering cholesterol to decreasing glucose and A1C. It's even been called nature's Ozempic. I'm talking about Berberine. When you look for it, you can find a lot of good reasons to take it.
Berberine might just be one of the best weight loss supplements that you've never heard of.
And this is why Berberine is equivalent to metformin, the main medication they use in type 2 diabetes, but without the toxic effect.
I lost about 6 pounds, and that made me happy by losing a pound pretty much every single week by just adding something like Berberine.
Overall, this implies that statin therapy was not as effective as Berberine, but not that it wasn't effective overall.
But you'll also find some not so good news, actually questioning its benefits.
Just be aware that there's still not a whole lot of information on what interactions Berberine has with other medications.
When insulin is lower, many of these benefits happen, but it's not a direct correlation. And like I said, the performance of Berberine is not predictable.
Trying to use Berberine to activate AMPK doesn't appear to be a convincing strategy.
I did a deep dive into the evidence behind Berberine. This is what I found. Welcome. Today we're going to be talking about, you guessed it, Berberine and the evidence behind it. Now, as you see, it's become really popular. A lot of people compare its benefits to prescription medications like metformin, which you heard, and even Ozempic. You know, the super expensive diabetes drug and weight loss medication that everybody loves to beat on these days. So, where's the truth in all this? Let's take a look. Jesus, if you'll bring up the slides, we'll get started. So, you could say that the truth about Berberine is really good. But maybe not that good. Jesus, if you've got... I'm having some problems finding the slide changer at this point. So maybe you'll have to hit the slide. Here we go. What is Berberine anyway? So let's talk about, just get into some basics. You know, people say, well, I'm not going to take a prescription drug because they're bad and supplements are safe. You know, supplements are made from plants. Well, so are prescription drugs for the most part. As most of us know, Big Pharma basically goes out and finds supplements that appear to be working, and then it tries to tweak those and become very wealthy based on that. So to differentiate too much between supplements and medications is probably an error. You need to know the details, know things a little bit more in detail than you might think. For the geeks out there, the term for Berberine is isoquinoline alkaloid. Don't need to worry about remembering that. Berberis, other herbs, antioxidants. They're anti-inflammatories. They're neuroprotective. They do decrease both cholesterol and glucose. There are some points indicating evidence for anti-cancer and promoting vitamin D absorption. So now let's get a little bit deeper into, after we look high level like that, let's look at each of the areas. In terms of cholesterol, Berberine is a safe supplement. It reduces triglycerides, total cholesterol, LDL, HDL, but no, it's not better than simvastatin. I mean, there have been head-to-head comparisons on that. Now, some people might say they think it's safer. I'm not going to get into that debate right now. How about metformin? Is Berberine better than metformin? Well, evidence would indicate, yes, it does reduce A1C, fasting glucose, 2-hour glucose, fasting insulin, and for you academics out there, even HOMA-IR. But no, again, it's not better than metformin in these areas. How about the effect on weight? Well, it does reduce body weight. It reduces your waist circumference. But there's no BMI reduction in patients with PCOS, polycystic ovarian disease. And no, it's not better than metformin for those patients. What's Berberine's effect on blood pressure? It does reduce blood pressure when combined with blood pressure medications. But again, it's not better than blood pressure medications. As we mentioned, PCOS, polycystic ovarian disease. You get higher ovulation per cycle in PCOS. You get reduced total testosterone and LH. In other words, you get some significant improvement and correction in the hormonal functions. Increased sex hormone or sex hormone binding globulin. And it's better for testosterone than metformin. But overall, is it better than metformin for a PCOS patient? No, not really more effective. So let's go to the next thing, inflammation. Yes, it does reduce C-reactive protein. And that's one of the key key inflammatory biomarkers that we look at for cardiovascular inflammation. There are other big ones too. Big ones, geek alert, TNF alpha, IL-6, patients with metabolic disease and type 2 diabetes. So yes, it does appear to impact positively those key biomarkers of inflammation. How about gut health? This is I was telling Jesus before the show, this is one of my favorite slides about gut health because this is gut cancer. This is cancer of the colon. This is the thing that is in a pandemic right now, especially in young people. And people just don't really understand that well how the process works. This makes a good point of how and why you need to have screening done. But that's another bunny hole. And let me get back out of that and talk about berberine again. There is evidence that berberine reduces the recurrence of GI adenomas, these things that end up in turning into cancers. It reduces H. pylori, that bug that causes ulcers. We used to think ulcers were just acid, and then we found out, no, it was a bug, bacteria. And berberine does reduce it. So it improves things related to both gut cancers and ulcers. How about liver health? It reduces AST and ALTs, a couple of the key indicators of fatty liver disease. It also improves kidney function. So let's jump on and move, as we're moving through this, talk about cancer cancer for a second. There is evidence that berberine can have a positive impact on rates of breast, colon, pancreas, stomach, liver, mouth, bone, glioblastoma, skin, uterus, prostate, thyroid, bunch of cancers. Now, how strong is that? And am I going to forget about my other lifestyle components and just take berberine? No, not me. What's berberine's effect on vitamin D? It might actually improve vitamin D absorption. And when it comes to vitamin D, there are two big issues. One is, are you actually taking it? Are you aware of it? Are you thinking about it? Number two, are you actually absorbing it? If the first part is the bigger part when you start looking population wide, but the second one is a big issue for a lot of people, and berberine may help there. Now, side effects. Berberine side effects are dose dependent. I'm not going to start getting into going down that bunny hole of bloating versus distension. I'm just going to list some of these quickly, and then we'll get into discussion in a minute. It can cause constipation, diarrhea on the other side, bloating. And some of these side effects are higher in patients with colon adenoma after surgery. It's safer in type 2 diabetes and pyloric infections. Now, what are the common medication interactions? The big one is what we call the macrolide antibiotics. And that's a technical term. Don't think about it. But you've heard of these drugs: azithromycin, erythromycin, Z-Pak, all of those things. Those are the macrolides. And when combined with those, you do have a serious risk, arrhythmias. So again, the devil's in the details, isn't it? How about price? Berberine is, in terms of your typical supplement, is priced about the same place where most of the others are. As you see, $24 a month usually is what you're going to see. Now, what's the usual recommended dose? It's not 5 grams. The usual recommended dose that you'll see out there is 1 gram, maybe 2. But a lot of the research that we've quoted, a lot of the evidence comes out of studies looking at these higher doses, like up to 5 grams. Is it a profitable business? Oh, yes. The berberine supplement market alone is estimated to be worth 2.1 billion within just a few more years. That's a report by Persistent Market Research. So, yep, it's big business. Yep, there's evidence that it helps. Yes, you have to be careful. Don't take it. Be careful, especially if you're taking one of the common antibiotics. Is it worth giving up all of your lifestyle components for and just depending on berberine? It's not that good. So, Jesus, anything else you want to add before we get started on the Q&A?
Let me tell you, I'm impressed. Absolutely impressed of the way you managed that, Dr. Brewer. Hi, everybody. It's very nice being here with you guys. We know Dr. Brewer is very loved out there, and we want to go to the bottom of the stuff that we're talking about as soon as possible. So, congratulations, Dr. Brewer. I do have a couple of things to mention. One, if you're asking is Dr. Brewer just pulling all this stuff out of his hat and just telling that out of his own experience, I'm the first person to tell Dr. Brewer, hey, we need to rely more than just in your experience, which is a lot. But I do like to go ahead and take a look at the evidence. And most of this evidence is coming from meta-analysis, studies of studies. And on the description, you will find the links if you want to check them out. There's one thing called umbrella reviews, which is a study of meta-analysis, which is a study of a study. So the most strong evidence we could find regarding berberine. There's a lot of stuff we don't know about berberine, but we do know that it's not better than medications. And even though we like supplements, we're also MDs, and we do try to analyze the evidence as it comes and make sure that if somebody's telling you that a supplement is better than a medication, that's true. And if somebody's telling you that supplements just because their supplements are safer than medications, maybe not. And Dr. Brewer skipped really quick on one slide, but I wanted to make a point. Berberine might cost about $20 a month. Metformin costs $5 a month. So if you think a supplement will be safer and you don't want to contribute to big pharma profit, that's absolutely fine. My perspective, in this specific aspect, I probably will take metformin rather than berberine. Somebody put in the comments, Peter T.S. said that berberine is the metformin of the poor people. I'll argue metformin is cheaper. Probably the problem with metformin is that you might need a prescription, and that's the expensive part. That's probably the big problem.
Pardon me if I'm getting too quickly into the Q&A, but Jackie Shaheen's making a point.
Yeah, sure.
And it's a very good point. Everybody's trying to get off metformin. Well, when Ben Bickman and all of these other folks talk about how bad metformin is and quote this research that, metformin damages your mitochondria. I mean, it's like the GLP-1. It's like Ozempic right now. Every content creator out there, almost everyone, wants to beat on these things. Well, these things got popular because they're good. We've covered metformin in other shows, and specifically the issue that's got everybody trying to get off of metformin, that issue of mitochondrial poisoning. Well, if you're taking 8 grams of metformin per day instead of like 1 gram, like our typical patient, then 8 grams of metformin is going to poison your mitochondria. So again, the devil's in the details. And it's just unfortunate for us as docs, knowing how prevalent, how common prediabetes is. 52% of everybody over age 18, and increases as you age. And as Jesus said, everybody's wanting to go away from a medication that you can get for $5 a month. That's really good and does not poison your mitochondria, and go pay 20 to 30 bucks a month for a supplement because they think it's safer. It's not safer.
Yeah, and we showed some of the doctors and influencers at the beginning, and we chose them because I think all of them are right in some way. All of them have a point. The problem is it's not black and white. There is a lot of gray area, and metformin and berberine share some mechanisms. It's just that metformin is stronger. Now, we're not saying stop taking berberine. If you want to try it, there's definitely evidence that Dr. Brewer just mentioned that it works and it can help. The big problem is relying only on berberine. If you say, I'm going to take berberine and then all my problems are going to be solved, that's the problem. And that's what we're trying to immunize you against.
I take berberine.
Mm-hmm. I don't, because I'm cheap compared to you, Dr. Brewer. And to me, it's easier to get some metformin, which I tried for a while. And right now, I don't think I need it, but I have it like on my list if at some moment I need more medications. In a few weeks, I'm going to show you my story on how I lost about 30 pounds. And we'll talk about metformin at that time. Okay, so you want to go to Q&A, right?
Yep, we should, because I'm already starting to answer questions here.
Oh, I see that. I mean, you're forgetting about the rules completely. I'm on the back, but I'm just watching. All right, let's go get that water bowl, Gilbert, if you can help us. So remember, if you're new to the channel, we have an option for you to become a channel member. Just go there, click the subscribe button, and click the join button. And as Dr. Brewer mentions, if you have ever seen the show Seinfeld, if you're not a member, no answer for you. Just kidding. We're just trying to get as many questions as we can, and we're going to prioritize members' questions. You will get an icon right there, just like Joe has next to your name. Cooled and unexplained fever starting a month after starting rosuvastatin be a side effect of the statin. What do you think, Dr. Brewer?
I've never heard of that. Never have.
I have.
Have you?
I have, but
Ace me again.
Well, I have, but it's not. It's hard to say it's just the statin. But if you're having a fever that is not because of an infection or for another issue, the statin can cause something that's called myopathy, which is breaking your muscles.
Oh, that's a big problem.
And that's very dangerous because those proteins can go to your kidney. Yeah, and they can cause kidney failure. Fever might be a sign of that. So it's a rare side effect. It usually comes with high doses of statins. It can cause fever. And if you're using statins combined with another lipid-lowering medication called fibrates, like fenofibrate, or what other is there that in the US, Dr. Brewer? Do you have? I know that you have fenofibrate. There is also, we don't use fibrates that much. Those are for decreasing triglycerides.
I don't use them that much either.
Well, if you're taking any of those medications plus statins, the risk of hurting your muscles increases, and that can cause fever. So
that's one of the reasons. Oh, go ahead.
No, yeah, go ahead.
That's one of the reasons that I don't use fenofibrates, because I think statins are more effective. And I know I'm going to get a whole bunch of hater comments for actually even breathing that. But, and we don't use mid-dose statins. We don't use high-dose statins. And you rarely get, I mean, it's very uncommon to get side effects when we're using the low doses that we use. For fenofibrates, it's just, the juice is not worth the squeeze. The added risk is not worth the improvement on it. So we've used them a few times, as you know, but very, 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 not very often.
In Mexico, I think the only cases where I use fibrates is if somebody has a genetic component with very high triglycerides, because they do decrease triglycerides. I do use them in those cases, but we have to we have to quit using statins if we do that, just because of the risk of this side effect specifically. Well, the muscle breakage side effect.
Well, I will go back and make the one comment that I was going to make earlier. Number one, the prevalence of statin and side effects is overestimated greatly. Number two, that unfortunately leads most doctors to ignore it whenever it's happening. So don't let your doctor ignore symptoms you may be having, muscle soreness, fever, things like that. Whether the doctor agrees with it or not, go off of it and see if that has an impact. Don't mess around with it.
Yep. Next question. What are the issues of berberine if one is taking levothyroxine because the person no longer has a thyroid? I'm not aware of any issues, but that's the problem.
Yeah, I'm not sure that there's a whole lot of evidence out there one way or another.
Yeah. Usually berberine, just similar to metformin, gets metabolized in the liver. Thyroid hormones don't necessarily get metabolized in the liver that much. But that's the big problem with berberine. Since a lot of medications are metabolized in the liver, we don't know necessarily all the interactions. On the description, on the very bottom, we have one article talking about toxicity with berberine. And that's a big issue. Since there's still plenty of research to be made, we're not sure. It's just something that something where the evidence is not there yet. Is taking trans K2 MK7 better than cis or type unknown varieties? Good to take K2 MK4 alongside. This is a K2 question. What do you think, Dr. Brewer?
I have never heard or seen of cis or trans isomers on that. This gets really technical. I'm gonna go uber geek for a second, but I've never heard of that with K2 and MK7. So our right and left hands are actually cis and trans isomers of each other. They're the same thing, but when you try to put them together, they don't actually fit. They're mirror images of each other. And that's exactly what a cis and a trans isomer is. It's a molecule, which is exactly, it's like a hand. It's got, an analogy, it's got 4 fingers and 1 thumb. It's flat. It looks exactly the same, but it's handed. It's a mirror image. Have you ever heard of that with K2, MK? You're looking at, see, I talked long enough to give you time to look it up on Dr. Google. That's what you just did.
No,
and you're going to take credit for already knowing it, aren't you?
No, I saw that with a comment of somebody else, and I meant to look for that. I need to do my research, but I can tell you, my perspective would be that probably is not such a big deal. Just like the comparison between hydrophilic and lipophilic statins. This looks more like a marketing thing where they add some geeky word additionally to the supplement to say that it's better. So to me, I don't think it's going to make such a big difference. What we have seen on the research before was K2, even if it's MK4, MK7, the most studied one, I believe it's MK4. Benefits are kind of similar. Might be better for some stuff than the other, but I don't think it's that big of a deal. What did you find, or what did you find right now?
Not that I looked anything up on Dr. Google, but actually it's interesting when the first thing that comes up is, it's a big deal. It plays a crucial role in bone and cardiovascular health. Cis analogs of vitamin K2 are biologically inactive. And the source is Nutra Ingredients USA. So it's not like they're
well, I'm gonna ask you one more time. The one paper that I'm seeing right now is from actually a journal.
Yeah, I'm looking at that now too.
So I think we need to do some research, but it's a very geeky concept that if you're into K2, I don't think it really matters. And that's a big problem with supplements at the end. I mean, everybody is doing their own formulas. They're going to label them as a marketing strategy as they want. There is no regulation. as
Yeah.
medication. So at the end, you don't really know if you're actually getting what they're saying that you're getting.
Well, that's the true. I mean, unfortunately, people bang on us for, saying, "Nah, take a low dose statin. Don't take red rice yeast." Or, you and I just said a couple of things a little bit more positive about taking metformin than a supplement. And
Oh, these guys are just trying to push medication into people, and
oh yeah, that's right.
that's not what we're doing.
You're goofy old doctors. You're trying to push medication. One of the issues that you just brought up is really, really important. The pharma, the prescription market is uber regulated, whereas it's just the Wild West. I mean, I'm looking at like a valid article indicating that cis versus trans isomer is important. But now the question is, what are you actually getting when you buy something? And there's going to be, you may hear that you will hear you're getting exactly the right thing that you need, but you may not be.
Yeah, and just to remember, we are into doing supplemental stuff. I mean, Dr. Brewer is taking vitamin K2. Dr. Brewer consumes natto, which is also a big source on MK7. We're just trying to provide some of those details that you might not find in the marketing strategies. And even if big pharma is regulated, that doesn't mean that there's not corruption and other stuff in there. I mean, that's just something that is hard to escape from anytime you're deciding to take a medication or a supplement. Those high serum glucose and insulin oxidize LDL particles. Very interesting question, Dr. Brewer.
Yeah.
And I don't have to look. I don't have to look it up. I think I know the answer, but I want to hear.
Well,
from
why don't you fire away? You go first this time.
I think not. I think not. It's not like glucose and insulin attached to LDL, as far as I know. I could go there to research and maybe say, oh, okay, there's some interaction between particles. But I think the big problem is both high glucose and high insulin would promote inflammation. And when you have a lot of inflammation, a lot of macrophages, immune cells will go there to where the plaque can start build up. And if there's any LDL particle in there, any cholesterol particles in there, they're going to get oxidized as part of the change on inflammation that is already started. That's where I like to say that even though LDL might cause inflammation, I think what happens usually is there is already some inflammation in there and LDL just goes away with it. It's more wood to the fire.
So, yeah, I tell you, I think this stuff is complicated enough. Cardiovascular disease, cardiovascular inflammation, metabolic disease, this whole thing of metabolic disease actually masquerading as cholesterol disease. What do you think? We go over this, I know I do it like 6 or 8 times a day when I'm seeing patients. What do you think about taking going back and do this? We've done it. We'll have to do this like every couple of years or so, and we probably should do it more often. Take a sample lipid profile, a sample fractionation, and show the the blue and tan particles. I don't think we can do that today. I think, what do you think about doing this as an upcoming show? Show the blue and tan particles, and then also show the loss of the bell curves for HDL and LDL. I think if we just went back and did that, it would help immensely. And I think we probably should do it like at least every 6 months or so, because people that flies over everybody's head.
All right. I think we should do that. And we know cholesterol is a very hot topic. And when talking about berberine, cholesterol is what's going to come up, because it does decrease some of those numbers. All right. So let me Harvey Ops is not a member, but he's a long-time viewer. We know him. Look at here.
Yeah, Jesus, you're beginning to look like a gym rat. It's all those big muscles you're making, I think. What do you think?
And I don't go to the gym. I just do at home, just body weight training. But I appreciate that. Okay. Mr. Clay, I have glucose readings in the mid 200s, even after 30 days no carbs. Very interesting. 3 grams of metformin will bring it back, bring it down about 100. And so, can a 7-day fast, if I stop metformin or stop my fast, my glucose goes up? Why? What do you
You want
think?
me I'll take a shot at that, and then you can look up stuff, and then.
I don't need to look up stuff. I know the answer for this one.
So I'm gonna call out our buddy Annette Bosworth. She's really good at describing this on a lot of her content, where basically your liver, after 30, 40, 50, 60, 70 years of eating a lot of carbs, your liver, one of your major roles for your liver is to store carbs in the form of glycogen. And you can get these little kernels of glycogen in there that will take forever to get out. So the typical the typical statement is, oh, okay, so if you could start fasting, just complete water fast, on day 3, you will have burned all the carbs, the glycogen out of your liver. Well, it depends on whether you started with a 2-pound liver or a 12-pound liver. It's just how much gas is in the tank. And so, Mr. Claywick, I applaud you for what you're doing, and it sounds like you got a good bit of gas in the tank there in terms of glycogen in the liver. The other thing that happens is you do get some metabolic inertia, and what I mean by that is, somebody with a BMI of 20, or the lower end 2-pound liver for years, eats a few carbs, it's going to be fairly easy for them to burn that out. But somebody else who's had decades of way too much carbs and too much glycogen in the liver, the minute they eat just a tiny bit of carbs, boom, it's right back stored in those little kernels in the liver. So that's my perspective. Jesus, you've had plenty of time to look it up now. Tell us the reality.
No, I think I agree with you 100%. Unfortunately, just like John C is mentioning here, I don't think you're gonna ever get medical advice on a YouTube forum.
But we can't.
But we can tell you about our perspective on the specific topic. And of course, there is a lot of players in this, a lot of players in this play, if we want to see it that way. And it's more complex than just mentioning carbs, no carbs, glucose down, glucose up, fasting, glucose down, glucose up. As Dr. Brewer mentioned, you can fast and your glucose can go up. You can do exercise, and for some time your glucose will go up as well during the exercise, as you're starting to use that gas that you have on the storage. Gilbert, can you put the Dr. Brewer's practice phone number in there? 859-721-1414, prepmedhealth.com. You can visit that if you want kind of an individualized advice on your own situation. There's a lot of stuff to analyze and evaluate. But yeah, if your blood glucose is in the mid 200s, usually that's a problem, and we need to find the root cause. For a lot of people, the root cause is carb addiction. For a lot of people, the root cause is just a poor glucose metabolism that's coming from age and genetics. So need to find out what's the problem. Body fat plays a big role as well. So
I got to share that. Thurston Howell the third. Yeah, what if they sold metformin as French lilac? We were talking about that right before the show, Thurston.
Well, we're talking. I bet that French lilac will get a lot of praise.
Yeah, everybody'd love it. They think it's natural, it's safe, it's great, it's not dangerous for you, yada, yada, yada. And that is one thing that we do, one role that we see for ourselves here on the internet, and that is the internet is so full of BS. And we've actually had training in epidemiology, the science of looking at medical science, medical articles. And that's one of our roles, is to try to, again, call BS.
Yeah. And sometimes,
go ahead.
no, sometimes we get too geeky, and that actually is a barrier to get the message across. So we're trying to simplify as much as possible.
Yeah.
All right. So let's go to JMK. JMK is also a loyal viewer. We appreciate it. Is it true that a statin therapy actually accelerates the atherosclerosis process or plaque buildup? I'm gonna go first then to allow Dr. Brewer to think about the answer that he wants to give.
Let me start looking it up here.
Now you're doing what I do. I think it might, especially at high doses, because one of the major side effects from statins is insulin resistance. And insulin resistance, we know it's inflammatory itself. So that's what happens. But also, it's not black and white. That's why we don't use high dose statins. That's the big reasoning. Low dose statins can actually decrease the inflammatory process. Now, talking about LDL, I'm gonna mention something about JMK, because I think that's where Dr. Brewer and I have a little bit of difference right now. For a show like 2 weeks ago, or a week ago, I believe, where Dr. Brewer wasn't around. 2 weeks ago, Dr. Brewer wasn't around, and I had the channel for myself and started to talking about the research that I found in regards to LDL cholesterol.
So while the meese are away, the cats will play. Is that right?
That's an old joke from when I used to have a very bad English. My English is still bad, but it wasn't as bad as it used to.
You were also bad with sayings because you had it backwards.
Yeah, I also have that backwards. I'm gonna spoil the beans here, as I say too. JMK, as Dr. Nadir Ali says, cardiovascular is an inflammatory disease, not a cholesterol LDL disease, which I think I agree. Dr. Brewer agrees with that, I believe.
Oh yeah,
LDL and LP(a) are firefighters. Right. They exist to put out the fire inflammation in the arterial wall. So, do you think that's still the case? I know that last year that was the mindset for both of us. Hey, LDL and LP(a) are actually firefighters. They're there to help you out. Do you still think that, Dr. Brewer? I'm putting you on the spot a little bit.
Say that last thing again. If you're going to put me on the spot, attorney, so let me make sure that I understand the question before
I know you're not. I know you're not necessarily 100% on any of those perspectives. I know you will not say that high LDL and high LP(a) are healthy, but you're not also saying that you need to put that down as less than 10 or 30 as possible. So what's your position in regards to LDL and LP(a)? Are them arsonists or firefighters?
I do more often. I have changed. I used to always think that they were the arsonists, and that was long ago. I have changed on that, and I think probably at least 80-90% of the time they're the firefighter instead of the arsonist. And maybe a firefighter, maybe not even a firefighter, maybe somebody else totally unrelated, like, the builder, when the house is burned down, then you get a whole bunch of builders coming in and starting to rebuild. I think that tends to be the issue more than anything else. As you've heard me say it enough times, if increased LDL alone were not a problem, we wouldn't see the challenges that we've seen with homozygous familial hypercholesterol patients, where these 13-year-old kids have a heart attack and their LDL is like 450, 350, 450. So, and then on the other hand, you see these lean mass hyperresponders that you and I work with all the time, where they have LDL at 350, but they don't appear to be increasing their plaque. Now, the other thing that you and I see, which is very subtle, and it's one of those things that would come under the category that you like to rib me about, and that is, quote, expert opinion. But you've seen it too, where these people come in, everything else, metabolically, they're great. They're a lean mass hyperresponder, and that LPPLA2 plaque
Yeah,
2.
inflammation marker. Yeah.
And it's that specific one that tends to just bubble along for those people. And it would indicate there is a little something going on there. But, I mean, you know me, you hear it all day, every day, whenever you're working with me. It's like, why are we missing the forest for the trees? And the problem here is metabolic disease. If we can fix the metabolic, if we can fix the preventable, fixable stuff in metabolic disease, we'll basically take cardiovascular disease off the table as a major public health issue. We just will.
Yeah. So, like, my perspective is, I'm glad that you mentioned the inflammatory markers, because that's where I start to go to the other side a little bit. I don't think we will ever prescribe high dose statins just to beat down LDL. But we also acknowledge that if you have a high LP(a), maybe higher than 300, you have a high LDL that is causing that inflammatory marker, LPPLA2, that we look for, starting to go up. And we have some patients that were dealing with that. They have everything in place: low insulin, low blood glucose, low A1C, low triglycerides, high HDL. They're in a good weight. They lost weight. And their only issue was a high LDL with a high LP(a)2, the inflammatory marker. And that's what we say, well, you might want to consider, if you have plaque, you might want to consider statins, low dose statins. And believe it or not, our experience has been, okay, we see a decrease on LDL. Maybe not, it doesn't necessarily have to go down to 70 as mainstream doctors want them. Maybe it goes down to something closer to 130. And we see the inflammation, LPPLA2, go down as well. And that's what we look at. And if that's experience, I say Dr. Brewer doesn't rely only on experience, but that's what experience is for. When you have conflicting evidence, which we covered 2 weeks ago, evidence in favor of LDL, let me put my hand over here, evidence in favor of LDL, evidence against LDL, that's when you use experience to try to interpret the results and see what we have seen in patients. So I think that's also a big positive for us. We both have the chance to see these in the evidence, plus on our patients. And this is the stuff that we don't agree with. I mean, if somebody's asking you to put your LDL down to 55 as the most important cardiovascular prevention strategy, that's where we say, maybe not. What about insulin resistance? What about other problems related to it, blood pressure, et cetera, et cetera?
Pardon me, but while you were talking, I went and looked at this Gildenhern Danish study that JMK is referring to, because I go back and I look and I thought, and that was my response. Where did you get that question? What's the question about statins causing increased cardiovascular or atherosclerosis? You brought up a good point that I didn't think about, and that is mid to high dose statins causing further metabolic disease or prediabetes. The other thing that I thought about was a probable red herring, and that would be, oh, well, you are going to get some increase in calcification in people taking statins. And a lot of people are going to interpret that as meaning, well, yeah, increased calcification is increased cardiovascular disease, it's increased plaque. You and I both know that's not what that means. Now, you got so long-winded. You gave me an opportunity to go look at the Gildenhern study, and now I'm even more.
You're not, aren't you supposed to know everything?
Yeah, absolutely. I know every piece of data. Just ask me. If I don't know it, I'll make it up. I'm often wrong, but never in doubt. But and so I took a look at this Gildenhern study that JMK is referring to. And now I'm even more confused, because it said, okay, what if you stop taking statins? And they did stop taking statins, and they died quicker. They had more heart attacks. So JMK, I'm really confused.
Dr. Brewer, I meant to cover that article. And I mean, we got wrapped up with a lot of other stuff. I think we should go back and cover that article somehow, because I saw the video from Dr. Cybus, our pal as well. We're getting pals from
Okay.
everybody.
Right,
YouTuber.
left, and sideways. Yeah.
You mentioned Dr. Boss. We're gonna have Dr. Boss on the show, just so you know, guys, next month. Be waiting for that. Dr. Cybus covered that article, and you actually have to buy it. So you need to buy the article.
Oh, that's
Be-
awful.
because there is evidence.
Robert.
They are quoting some stuff on the supplemental information that is not available on there. You need to download the supplement information to get that evidence on statins are not decreasing cardiovascular risk. I saw the article. I got kind of the same notions that you just had, but I need to read it completely. We need to buy it, and then we can talk more about it. I think we're gonna go to the last question. Rick Folia, when surgeons scrape away plaque, are they removing the intima too? Or fatty streaks in lumen and under intima? Rick Folia, you're one of our geeky audiences, and we're trying to get this for people who doesn't know anything about this. So let me try to translate. So when you're starting to well, I'm gonna fail miserably. Then you can translate for me.
I'll try to translate for his translation.
Please do. So you have your artery wall, then you start building some plaque, and that plaque is made of yes, some cholesterol, but also liquid, which is similar to pus, which we call inflammation. That's below a layer that is between the blood flow and the wall of the artery itself. That's called the intima. And those fatty streaks is basically that plaque, which is some cholesterol in it. And the lumen is basically the inside of the artery where the blood flows. So he's asking if they scrape away the intima when they go ahead and try to. I mean, I'm guessing when they're placing a stent, because that's what they do. I mean, I don't think they're kind of doing a lot of scraping away. They're just placing the stent. They do some cleanup, but they put the stent on it.
Yeah, I'm not. I
might be a good question for Dr. Obedia, who is a cardiothoracic surgeon, and he used to do that.
Could be. It was there was a fellow named Louis B. I think it was Louis B. Jenkins. He was like Dr. Endarterectomy. He was a surgeon, one of the first surgeons that subspecialized in a certain specific process and just did gazillions of them. Got really high quality at it, but we don't do that anymore. And what I'm talking about is endarterectomy. Back when I was in school, and that was back when we were still using leeches. He
Aren't you using those anymore?
No, they're actually going back to using them, but that's a different issue. So he specialized in going into the neck, opening it up, and stripping that stuff out of the artery, just like Rick Foley is talking about. It's occasionally done now, but not that often. And why? Well, because we found that it didn't work. So, except in some very extenuating circumstances. And if you're having to rely on a carotid endarterectomy, you need to be thinking really hard about some other metabolic stuff. So the point behind all that is we've tried all the scraping away plaque business, and it's not a winning solution.
And my guess will be, you're gonna probably hurt that intima. I mean,
yeah, you're just going to scar it down. It'll regrow to the extent that it can regrow, but it's not going to stop the metabolic process, and it's not going to stop the probability of you forming inflamed plaque, and that plaque squeezing out, touching the blood, and forming a clot.
And it worked for us to know that there were microplastics on that plaque. A recent study showed that people who had that procedure done, taking plaque out of their artery from their neck, they saw that plaque, and they turned out it had microplastics, and people who had microplastics had higher risk of events. So that's just another drop in the bucket for cardiovascular risk factors. But yeah, my guess is yes, you will get some damage to the intima anyway if you do that. All right, so good show, Dr. Brewer. You did really good. Leave your comments or your questions in the comment section afterwards. Next week, we're going to have Dr. Casey Means. Casey Means, who has a really good book called Good Energy. And we're discussing the root causes for inflammation and cardiovascular disease with her. Really good show that you don't want to miss out. Also, yeah, go ahead.
She taught me how and why, as an adolescent, I ended up looking like football head.
Oh, yeah.
Hey, Arnold, I had major allergy issues. And it turns out it's our old friend, our old nemesis.
That's
We'll
right.
talk about it.
Good hook, Dr. Brewer. Who is that
There you
nemesis? You need to wait for next week.
Who's that bad?
Really good. The other thing is starting, we're gonna have a graphic for that. But just so you know, guys, if you're here in the video still, you're a hardcore fan, and we appreciate you. Starting August the 15th, that's the third week of August. We're gonna move the shows from Wednesday to Thursdays. Same time, just Wednesday to Thursdays. So we're gonna be reminding you, it's 1 month away. We're gonna have to move there just because Dr. Brewer said so. Now there's some reasons behind it. We can discuss that later.
Actually, it's for our viewers.
Yeah, most people are gonna be able to see that on Thursday, and you can always watch the repetition. So, Dr. Brewer, any closing remarks?
As I used to say, thank you for your interest, but now Jesus has me saying, do not let Tony the Tiger take over dinner. Don't do it.
See you next week.